Welcome to Medical Desk, your channel for all things related to healthcare and medical knowledge. Subscribe and stay tuned for more health knowledge.
The anterior cruciate ligament, or ACL, is a tough band of tissue that connects your thigh bone to your shin bone. This ligament is one of the key structures in your knee that helps maintain its stability and function. Picture it as a strong rope within your knee joint, providing stability and control during movement. This rope-like structure is essential for keeping your knee joint aligned and functioning properly. The ACL's primary function is to prevent the shin bone from sliding out in front of the thigh bone, ensuring smooth and coordinated motion. It acts as a crucial stabilizer, especially during activities that involve sudden changes in direction or speed. Without a healthy ACL, your knee joint becomes vulnerable to instability, making everyday activities like walking, running, or pivoting difficult and potentially painful. This instability can lead to a lack of confidence in your movements and a higher risk of further injury. Imagine trying to build a house on a shaky foundation. That's essentially what it's like to live with a torn ACL. The knee joint, much like a house, needs a solid foundation to function correctly and support the body's movements. The ACL is crucial for athletes involved in sports that require sudden stops, changes in direction, and jumping. These high-impact activities put a lot of stress on the knee joint, and the ACL helps absorb and manage that stress. However, anyone can tear their ACL through a variety of mechanisms, including sports injuries, falls, and car accidents. Even a simple misstep or awkward landing can result in a significant injury to this vital ligament. When the ACL is torn, it's like that strong rope inside your knee snaps, leaving your joint vulnerable and prone to further damage. This can lead to a cascade of issues, including other ligament injuries, cartilage damage, and long-term joint problems if not properly treated. Delaying ACL surgery, while sometimes necessary, comes with inherent risks and potential consequences. While some individuals may opt for a period of non-operative management to allow swelling to subside or address other medical concerns, it's crucial to understand the potential downsides of postponing surgical intervention. The decision to delay surgery should never be taken lightly and should always involve a thorough discussion with your orthopedic surgeon. Factors such as age, activity level, and the severity of the tear all play a role in determining the best course of action. Postponing surgery might seem like a tempting option, especially for those wary of the recovery process. However, it's essential to remember that delaying surgery could potentially lead to further damage within the knee joint, ultimately complicating the healing process and increasing the risk of long-term complications. One of the most significant risks associated with delaying ACL surgery is the increased likelihood of further damage to the knee joint. The anterior cruciate ligament, or ACL, plays a crucial role in stabilizing the knee. When it's torn, the knee loses its primary stabilizer, making it vulnerable to a cascade of other injuries. Without a functioning ACL, the knee becomes unstable, making it susceptible to additional injuries to other structures, such as the meniscus, which are cartilage pads that act as shock absorbers. The meniscus helps distribute weight and reduce friction during movement. When the ACL is compromised, the meniscus is at a higher risk of tearing, which can lead to pain and swelling. Imagine a car trying to navigate a winding road without a steering wheel. The instability caused by a torn ACL can lead to the knee giving way, increasing the risk of falls and further trauma to the joint. This instability can make everyday activities, such as walking on uneven terrain or climbing stairs, incredibly challenging and dangerous. This instability can result in damage to the meniscus, cartilage, and other ligaments, potentially leading to more complex surgical interventions and a longer, more challenging recovery. The longer the knee remains unstable, the more likely it is that additional injuries will occur, complicating the surgical repair process and extending the rehabilitation period. Moreover, delaying surgery can allow for the development of arthritis within the knee joint. Arthritis is a degenerative condition that causes the cartilage to wear away, leading to pain, stiffness, and decreased mobility. The unstable environment created by a torn ACL accelerates this wear and tear, making arthritis more likely to develop. The unstable environment created by a torn ACL can accelerate the wear and tear on the cartilage, leading to pain, stiffness, and reduced range of motion over time. This can significantly impact the quality of life, making it difficult to perform daily activities and enjoy physical activities. Early surgical intervention can help restore stability to the knee, prevent further damage, and improve long-term outcomes. Section 4. Muscle atrophy and instability. A recipe for long-term problems. When we talk about the knee, it's crucial to understand how interconnected the muscles and ligaments are. The knee joint relies heavily on the surrounding muscles for support and stability. In addition to the risk of further damage, delaying ACL surgery can lead to muscle atrophy and ongoing instability. This isn't just about the immediate pain or discomfort, it's about the long-term health of your knee. The longer you wait, the more these issues can compound, creating a cycle that's hard to break. When the knee is immobilized or not used properly due to pain and instability, the muscles surrounding the joint, particularly the quadriceps and hamstrings, can weaken and shrink. This weakening isn't just a minor inconvenience, it can lead to significant functional impairments. The quadriceps and hamstrings play a vital role in knee movement and stability. Muscle atrophy can further compromise knee stability, making it difficult to regain full strength and function even after surgery. The process of rebuilding muscle strength is arduous and requires consistent effort and time. Without strong muscles, the knee joint remains vulnerable to further injury. Imagine a building with weakened support beams. The lack of muscular support around the knee can lead to a vicious cycle of instability, pain, and decreased mobility. Just as a building needs a strong foundation, your knee needs robust muscles to function correctly. This ongoing instability can significantly impact your daily life, making it challenging to perform simple tasks such as walking upstairs, getting out of a chair, or participating in recreational activities. Everyday activities that were once taken for granted can become daunting challenges. The longer surgery is delayed, the more pronounced these effects can become, potentially leading to a more difficult and prolonged recovery period. Early intervention is key to preventing these long-term issues. By addressing the problem promptly, you can avoid the cascade of complications that come with muscle atrophy and instability. Rehabilitation and recovery are much smoother when the muscles are still relatively strong and functional. Section 5. The mental toll. Coping with a delayed decision. Beyond the physical implications, delaying ACL surgery can also take a toll on mental well-being. The uncertainty surrounding the decision, coupled with the limitations imposed by an unstable knee, can lead to feelings of anxiety, frustration, and even depression. Athletes in particular may struggle with the inability to participate in their chosen sport, leading to feelings of isolation, loss of identity, and a sense of grief over their athletic career. Imagine being sidelined from a sport you love, watching from the sidelines as your teammates continue to train and compete. The emotional toll can be significant. It's essential to acknowledge the emotional impact of a delayed surgery decision and seek support from mental health professionals, support groups, or loved ones. Addressing the psychological aspects of the injury is crucial for maintaining a positive outlook and navigating the challenges of recovery.